Guthrie Model of Care is a change in our way of doing primary care here at Guthrie, and it eventually is going to expand to the other specialty clinics as well. The shift is from the historical method of just looking at 20-minute appointments for each patient encounter, and really a change to be a patient-centered encounter, where we recognize some patients need more than 20 minutes, and vice versa, some encounters could be a little bit shorter depending on what the need is at that time. So it's going to be empowering providers and the care teams to be able to adjust the schedule to best meet those needs. It also is going to include a push to incorporate more virtual or video encounters as a way of meeting patients or providing care at the time and place that best fits their schedule. Traditionally, Army medicine was done where a primary care provider was deemed successful if they had 100 encounters completed a week, and each encounter would be a face-to-face visit with a patient. Values-based care pivots away from saying everyone needs to do 20 visits a day and instead says, hey, we need to provide care that best meets the needs of the population. This could be in the form of a combination of face-to-face, over the phone, or video visits, and it also might be visits of different lengths or durations or even frequencies than the previous model had. So a lot more flexibility to meet kind of the demands of the patient or the community. The biggest thing that I think excites me about it is the opportunity to tailor the length and duration of appointments to that individual need. So I think it's going to be an improvement in access to care, and it's going to be a slight change towards that digital frontier of medicine. So it's going to give the opportunity for people to get either the medicines, referrals, labs, or questions they have answered in a more timely manner. But sometimes that answer, instead of a face-to-face conversation, may come as an over the phone or through the video camera discussion with either a provider or one of the other members of the care team, like a nurse. The best way to get a hold of us is going to be sending a message through the patient portal. So you can actually go in the portal, pull down the name of all the providers at our location, and then choose the provider you've been assigned to. That's going to go through, and our nursing staff is going to review your message and then reach out directly to you to see if it's something they can answer or work on immediately. And if you need an appointment, then they're going to be able to reach to you directly and find a time that's going to best work for you, as well as the earliest possible time to get you in and be seen. So beneficiaries can still reach out through your appointment line. There are going to be some sorts of appointments that they can book directly. So good examples of that would be like a well child visit or my annual exam. There's also going to be some requests for appointments that might need to be vetted through one of our RNs to see if there's some things they could do faster than waiting for the next appointment. And that may result in the call center creating a message and sending it to our care team, and one of our RNs reaching out directly to the beneficiary. So those appointment types can be face-to-face, over the phone, or we call those virtual, or video encounters. And we expect to try to transition more and more towards that digital option, because the anticipation is that people will like the ability to fit that into their schedule. I would say new things are definitely a cause for anxiety or stress for most people, myself included. What is really exciting about our video platform is how similar it is to just being on FaceTime or almost like a Skype setup that you might have done already with another family member. Like any new process, we are looking for feedback as it rolls out, and this is something that we're going to continually be seeking to build and improve. We expect there will be a few hiccups in the beginning, and so if there's friction points that beneficiaries are experiencing, we want to know about it. Whether that's through an ICE comment, a Joe survey, patient advocate, or reaching out to me directly, that feedback is going to really help us best adapt this and continue to improve the model of care to fit our needs.